All right, it's your chance to ask the doctor this morning. Call us now at 741 WBRC 741-9272. Dr. Jerome Williams, a regular on our program, is here along with Jillian, and we're just getting acquainted this morning once again. It's been a long time since we've been together, Jillian.
Yeah, she's loving you this morning.
She is a sweetheart, such a sweet dog.
I hope our viewers have not fed their pets too much of the Christmas and New Year's season foods that causes digestive problems. They can get pancreatitis from them. Diarrhea and other uncomfortable things for the pets.
It's really not good for them. The table food really is not good for them. They can't digest all that fat, for one thing, right?
That's correct. That's correct. And many of the systems just not used to it. You know, we think it's so nice to give them a little treat, or the bones, or those other things that, you know, we eat and think that they should have as well. Things like raisins that are not good for pets either.
Okay, there you go.
Be very careful on
heard
those.
About the grapes, and they're just dried. I mean, raisins are dried grapes, so that would follow. And of course, everybody knows about chocolate and onions and garlic and those kinds of things.
Right. So we got to be real careful with those pets this time of year.
Okay. Wow. So in terms of the cold weather, what are you seeing in terms of?
We got to be sure that we provide the adequate shelter for them. When it's cold like this, we need covering. The house needs to be turned so the wind does not blow in it directly. Okay. And some kind of blanket or something in there. All
right, we've got Candace from Hoover on the line this morning. Candace, good morning.
Good morning.
What's your question for Dr. Williams?
Hi. Hi, doctor.
Hi, Candace.
I have a pit bull terrier, and he has these little, they look like mosquito bumps up under his fur. I'm not sure what it is. I thought maybe it could be allergies or something. It don't bother him, but every so often I notice these little bumps up under his skin.
Are they all over, or just in a certain location?
They're like some of them may be on his leg, on his back.
It sounds like an allergy to something. If it's not fleas, the first thing we want to rule out when we got a skin problem or bumps and things like that is rule out fleas. If it's not fleas, then it's probably allergy to something else, and determining what that is can be a challenge for you.
Okay. Okay. Well, thank you very much.
Okay. All right.
So you'll need to take him into your veterinarian just to get a quick synopsis of what's really going on, Candace.
Absolutely.
All right. Thank you for calling. Matthew from Alabaster, good morning.
Good morning. How are you?
Good morning to you. What's your question for Dr. Williams?
Okay, I have an 11-year-old golden retriever, and we got his hair shortened down this past summer just to keep him cooled off and everything because of his thick fur. The question I have is certain spots have not grown back since that haircut.
Wow.
And out of curiosity, what's a way to kind of help get that hair growing back? Because he's an outdoor dog, and with this cold weather, don't want to take any chances.
At 11 years old, you want to get some blood work done to see if there's anything going on. At that age, I suspect you might have things like thyroid problem or liver problem. Do that first to make certain that there's nothing else going on there. And if nothing else is going on, then make sure you have the right diet. A diet for older pets at this point would be helpful, and make sure you have the supplements that you need, like the vitamins that contains the vitamins A, D, and E. Fish oil is a good source of that.
Yes, sir.
All right, Matthew, I hope that helps you. You have another question?
No. Go Buckeyes.
Yeah, give that a try.
He said go Buckeyes. All right, Matthew, thanks so much. All right, Sandy is from Clay. Good morning, Sandy.
Good morning.
Good morning to you. What is your question for Dr. Williams?
I have a 4-year-old pug Chihuahua mix, and he's scratching constantly.
Oh, wow.
And there's no fleas or anything. I went online, and it was suggested I give him some Benadryl.
Benadryl will help to control the itching. You give it at the dosage of 1 milligram per pound. You can give that 2 or 3 times a day if you need to. But if you get that consistent scratching, you got a bigger, deeper problem that needs to be addressed. If it's all over the body, then it's something else going on. If it's just certain locations, then you might could help identify the source of it, whether it's something like a food allergy, or whether it's a contact allergy or something like that. But it's something that needs to be seen. But Benadryl will help some of the allergies, to control some of the allergies.
Does sound like an allergy though, because the dogs manifest that through their skin, don't they?
Exactly, they do.
All right. I hope that helps you.
Well, it does, but I've also heard that if I put some olive oil in his food, that would help because it's
fish
got
oil would
dry
be-
skin.
Fish oil would be better if you can get one of the ones, would be better than the olive oil.
Fish oil?
Mm-hmm.
And how often can you give that?
You give it
to
daily. I mean, you can put that could be a continuous thing to give. It has your vitamins A, D, and E, and your essential fatty acids.
Well, that helps me out. I appreciate it. Thank you so much.
All
Sure
right.
thing.
All right. Sheila is from Silicaga. Good morning, Sheila.
Hi. I have a little shorty that's about 2 years old. Every once in a while, he's throwing up, and I would like to know what can I do about that.
That's a biggie. That
Yeah.
depends on what's causing it. Now, pets can get reflux just like we can, but animals often will eat grass or eat too fast and get air down with the food. But give them some of the medication you would give for a person for reflux and see if that makes a difference. And make sure that the eating is not too fast, that it's measured, that he's not just wolfing the food down, like he's in competition.
Okay.
All right, Sheila. Thank you so much for calling, and to all of our callers, thank you for calling in. And Dr. Williams, of course, we appreciate your expertise as well.
Happy New Year to
it's
all of
been a
our
pleasure.
viewers.
It's been a pleasure, Jillian.